Hello, I'm Kyle Alley.
I'm Maggie Gilman.
I'm Vivi Baby.
And I am Claire Kostriva, and we will be doing a lecture on the mouth. Alright, so another name for the mouth is the oral cavity and the buccal cavity. And it begins at your lips and it empties into your throat. So key structures of the mouth include your lips, your gums, the hard and soft palates, your tongue, your teeth, your tonsils, your salivary glands, and your uvula. So while you're eating, the cycle goes, you put the food in your mouth, you chew it around, you move it around with your tongue, which kind of creates the bolus, and then you push it back into your epiglottis and your esophagus.
Okay, so next we're going to be talking about the lips. The lips are one of the soft, pliable, anatomical features of your face, and they have four main zones. The first one is the hairy skin, which is around the lip area, and then the next is the vermilion border, which is going around the lips, both on the top and on the bottom, called the upper and the lower vermilion border. Then the vermilion, which is the pink part of your lips, which is the fullest. And then the oral mucosa, which is not shown on this slide, but it's the inner part of your lips that pushes against your teeth, so right there. And the shape of your lips depends on your age and your ethnicity, and yeah. So the vermilion is what I said before, is the red part of your lips. It's covered with a specialized stratified squamous tissue, and it connects into the oral mucosa, which is a non-keratinized stratified squamous epithelium. And the vermilion border is the rim of the vermilion, and then the hairy skin zone that goes around the lips. And right here is the philtrum, which is then connected to where Cupid's bow is. And so the ridges right there are where the philtrum is, and then the Cupid's bow is right below it.
All right, next we're going to be talking about the gums. So the gums are also called the gingiva, and they are connective tissue that is covered with a mucous membrane, and they are attached to the necks of your teeth and the adjacent alveolar bone. And when tooth eruption is complete, the gum embraces the neck region of each tooth and holds it, and as well as being attached to the adjacent alveolar bone, the gum is connected to the center of each tooth and the tooth enamel. So over here is a healthy set of gums, and this is gingivitis, which is inflammation of the gums at the neck of the teeth. And then this is periodontitis, which is inflammation that affects the bone and the tissues of the teeth.
So the next structure of the mouth that we're talking about is the hard palate and the soft palate. So the palates form a division between the nasal and the oral cavities, and it is separated into two parts. So the hard palate is comprised of bone and it is immobile, and the soft palate is comprised of muscle fibers covered by a mucous membrane and is mobile. So there are three main canals in the hard palate. The incisive canal, which is located in the anterior midline, which transmits the nasopalatine nerve. The greater palatine foramen, which is located medial to the third molar tooth, and it transmits the greater palatine nerves and vessels. And the lesser palatine foramen, which is located in the pyramidal process of the palatine bone, and this transmits the lesser palatine nerve. So the soft palate can be elevated to close the pharyngeal isthmus during swallowing, which prevents the food bolus from entering into your nasopharynx. And it is located posterior to the hard palate. And anteriorly, it is continuous with hard palate and with a palatine aponeurosis. So the posterior border of the soft palate is free, it's not connected with anything, and it has a central process that hangs from the midline, which is the uvula. So the soft palate forms the roof of the fauces, which is an area connecting the oral cavity and the pharynx. So the superior aspect of the palate is your nasal cavity, so here's your hard palate and here's your nasal cavity, and that is in the respiratory epithelium. And the inferior aspect of the palate is your oral cavity. and this is the oral mucosa and is populated by secretory salivary glands.
Okay, so now we're going to be talking about the tongue. So the tongue is defined as a muscular organ, and it's attached to the hyoid bone, and it's in the back of your mouth. The tongue has many functions, but some common ones are that it's vital for chewing, swallowing food, and it assists in speech. The tongue is covered with moist pink tissue, and that's called mucosa. And as you can see in the picture, there's papillae on the tongue, and that's what gives it its texture. The tongue is anchored to the mouth by webs of tough tissue, and that tissue is called mucosa. There's tether holding down the front of the tongue, and that's called the frenum. There's different tastes that the tongue can encounter, and those are sweet, sour, bitter, salty, and then a different one which is called umami, and that results from tasting glutamate, which is also known as MSG. So for tongue conditions, the first one is thrush, and it gives your tongue like a white look over, and that's actually yeast growing on the surface of your tongue. It can occur in anyone, but it's more often to occur within people who are taking steroids or have suppressed immune systems, which would be like really young people or older people. The next condition is geographic tongue, and it's inflammation of different parts of the tongue. So you can see that it leaves like what they call little red islands, and it's just where the papillae on the tongue are missing. There's many forms of oral cancer, but some can occur on the tongue. As you can see, it's like an ulcer growing off the tongue, and it's more common to happen in people who smoke and drink. It also can cause black tongue, which is just where your tongue gets black and hairy. Another thing is canker sores. They're just small, painful ulcers. The cause is unknown, and they are common within people. They're not contagious, but it is known like you can prevent them from happening if you just rinse your mouth with salt water.
So next we're going to be talking about the teeth. The teeth are located in the alveolar process, which is in the mandible and the maxilla. The first 20 teeth that you have in your mouth develop between 6 months and 3 years old, and you lose them when you're from the ages of 6 to 12. So those are the teeth that you pull out, that they're painful, and then you have like a bloody little hole for a little bit, and then a few weeks later they grow back. The second set of teeth that you get are the 32 secondary teeth, and that happens from when you lose your first couple of teeth until your adulthood. So the next time that you lose your teeth, you're going to be needing to have dentures. When babies are from 6 to 10 months, they start getting their teething stage, and that's when the central incisors begin to form from the bottom set of your gums and the top set of your gums. And then from there is when they want to always be biting something, and then they start getting the rest of their teeth. So the different parts of one singular tooth are many, as you can see. So we first start with the crown and the root. So the crown is the part that's sticking out and that you can visibly see in your mouth, and then the root keep going down into your gums, and that's the part that when you pull out you see the extra excess that you never seen before. So on the crown there's a covering called enamel, and that's what is protecting the tooth from decay and from the different types of acids that you're putting into your mouth, which is why we should be brushing our teeth at least twice a day, and why it's so important that we do protect it and keep it clean. The dentin is the more bulkier part of the tooth. So here is like a less dense, and then this is more dense. And that's called the dentin, and that's like the just the main body part of the tooth, and that's being protected. And then when you go inner, that's the pulp, which is a softer living inner structure of the tooth, and that's where you can see the nerves building up over there. So there's different types of teeth in your mouth that make up your entire tooth family. So you have the incisors, which are the 8, 4 on top, 4 on the bottom, teeth that are right in the middle. And then you have the canines, which there are 4 total. There's 2 up here and 2 down on the lower jaw, and those really help with when you're biting food. It helps chew it up, and you can sometimes hear a joke about dogs being called canines because their canine teeth are very prominent, and so yeah, fun fact. And then you have your premolars, which are from the canines to the back. There's 8 of them total, and they're just kind of just there, and they help with chewing food as well. And then you have your molars, which are the flat teeth in the back of the mouth, and that's where, like, when you're pushing your food back towards the back of the mouth, it helps it grind it up even more. And then everyone's favorite, the wisdom teeth. These start coming out of your gums when you're around the age of 18. For some people who are lucky, they have enough space in their mouth to let them grow and they can live with them for the rest of their life. Otherwise, you have to get them removed, and it can be painful sometimes. Sometimes people get all 4 out just to get them done with. Sometimes people do 2 at a time, depending on what the orthodontist or dentist recommends. It's just better to get them out so you don't have to deal with pain at certain times of your life. Some conditions that happen with teeth are cavities, which you can get from a very small age, and that usually happens when you're eating a lot of sugar, and it damages the enamel, leaving little small holes in your teeth, and you can get them filled with either like a clear filling or metal filling. You can get periodontitis, which is explained by Kyle before, which is the inflammation of the deeper teeth structures, and that can come from just poor oral health. And then plaque is the stuff that we brush away every day, and it's like that sticky just film over your teeth that can also cause bad odor in your mouth. And tartar is a result of plaque not being removed, so if you're not brushing your teeth, the tartar gets hardened and it's just harder to get rid of and just causes a lot of oral issues. And teeth grinding is something that happens when you're asleep and your jaw just kind of like shifts back and forth, and you're not doing it on purpose, it just happens in your sleep, and when you wake up you can feel a headache or just sore jaw as symptoms, and you know that you have teeth grinding in your sleep because of stress or anxiety or whatever going on.
Okay, the next structure of the mouth that we'll be talking about are the tonsils. So your tonsils are a pair of soft tissue masses located at the rear of the throat, and each tonsil is composed of tissue similar to lymph nodes covered by pink mucosa. So running through the mucosa of each tonsil are pits, which are also called crisps, which you can kind of feel because you'll have like either tonsil stones that kind of get tucked behind them. And your tonsils are part of the lymphatic system, which helps to fight infection. And they vary widely in size and swell in response to infection. So normally when people have like larger tonsils, they have like a harder time breathing like at night, and the first response is like to usually get them taken out, but that's not as common anymore. So tonsil conditions, so one is acute tonsillitis, which is a bacteria or a virus that infects the tonsils, causing swelling and a sore throat. And your tonsils may develop a gray or white coating, which I guess is just the difference spotting on here, and it is a type of pharyngitis. Another tonsil condition is peritonsillar abscess, which is an infection that creates a pocket of pus next to your tonsil, and it pushes your tonsil towards the opposite side, and they need to be drained urgently. Strep throat is common, and it is a bacterium that infects the tonsils and the throat, and it can cause fever and neck pain, often and your sore throat. Tonsillitis is pretty common in your tonsil stones, which get tucked in like your crypts, and they are formed when trapped debris hardens or calcifies. And gargling salt water can ease the throat discomfort and may dislodge the tonsil stones.
Okay, now we're going to be talking about the salivary glands. So the purpose of the salivary glands is to secrete saliva, and saliva binds food together and begins the process of chemical digestion. The parasympathetic nervous system and the sympathetic nervous system regulate salivation. Within our salivary glands, we have 2 cell types. First, we have mucus cells, and these are the ones that secrete mucus. And then we have serous cells, and they have a watery secretion of salivary amylase. And salivary amylase is what starts chemical digestion, and it breaks down polysaccharides, starch, into disaccharides, maltose. So the first gland is the parotid gland. It's found towards the back of your head and in the very back of your mouth, and it's made up of mostly serous cells, which means that the saliva it secretes is more watery. The second kind of salivary gland is the submandibular gland. It's the second largest gland, and it has a mix of both cells, so it has about a medium viscosity. And the main excretory duct is the wart duct. You can see in that picture that it's just a microscope slide of the different kinds of cells within the submandibular gland. The last gland is the sublingual gland. It's almond-shaped and found underneath the tongue. You can see in relation to the parotid gland and the submandibular gland. It's made mostly of mucus cells, so it has a mucus-y secretion and it's thick and streaky. So one common disease that happens within your salivary glands is psilolithiasis. It's the medical term for salivary gland stones that occur within your salivary glands. The causes of this usually include dehydration or use of medications that cause you to have dry mouth. It can make it really difficult for you to open your mouth, swallow, and have a painful lump under your tongue. Treatments depend on the size of the stone. Sometimes hydration will help remove some, and then sometimes they're so big that you have to have surgery. Another disease is Sjogren's syndrome. It is chronic inflammatory disorder characterized by dry eyes and dry mouth. The first target is the lacrimal and salivary glands, which are the ones that make tears and saliva, but it can target other places of the body that aren't even related to that. The causes are thought to be within genetic information, and treatment works on relieving the symptoms more than finding a cure because it's just a broad disease.
Alright, so next we're going to be talking about the uvula. And the uvula, also called the palatine uvula, is a conic projection in the back of the middle soft palate. It's composed of mostly connective tissue, and it has racemous glands, muscle fibers, and serous glands. The function of the uvula is when you're swallowing, the uvula and the soft palate, they come together to shut off the nasopharynx, which prevents food from going into the nasal cavity. It keeps the throat lubricated with saliva. It's used to articulate consonant sounds when you speak, and its stimulation causes gag reflexes to occur. The racemous glands, pictured here, produce large amounts of thin saliva, and it looks like a bunch of grapes, and it's similar to alveolar glands. The serous glands, here, secrete a serous fluid that is isotonic with blood plasmid, and it contains many enzymes, one of which is alpha amylase, which Maggie talked about. It's the first enzyme used in food digestion. And one of the conditions is uvulitis, which is a swelling of your uvula, and it touches your tongue, which causes gagging and choking to occur, and it also causes problems with breathing, eating, and talking. And one of the biggest conditions caused by your uvula is sleep apnea, which causes problems in breathing when you're asleep, and it's caused by an elongated uvula, so it's too long, and it can be treated with either removal of the uvula or parts of it, or a uvulopalato-pharyngoplasty operation. And these are our references, and some more references.